Speaking of video question, doctor, I have one this time from Beth. Let's see what she writes or she says.
Hi, my name is Beth Lagan, and I have some questions regarding prostate cancer. In the instance somebody is diagnosed with prostate cancer, does the prostate always have to be removed? And if so, is it possible for that person to still be intimate? Or are there different types of procedures for the prostate when you're diagnosed with cancer, depending on the stage?
All right, several questions there from Beth. That was fantastic. I really appreciate those questions, Beth. Let's go with the first one, doctor. I wrote it down. Does the prostate always have to be removed?
Absolutely not. So it really depends on the stage and the grade of cancer. So that's the first thing we usually do when we evaluate prostate cancer is we grade the cancer, we stage the cancer. So for patients that have localized cancer, meaning cancer that's just in the prostate and it's low grade, meaning not very aggressive, a lot of times what we'll do is we'll watch that prostate cancer because patients are more likely to have cardiac events, stroke events, et cetera, that are the cause of their mortality or morbidity down the road. And so we call that strategy active surveillance, where patients get routine PSA tests, they get routine prostate exams. A lot of times they'll get additional imaging, MRIs of the prostate to evaluate those tumors to see if there's change. And frequently they'll get repeat biopsies every 1 to 2 years, again, to see if there's physical change on the needle biopsy. So prostate cancers don't necessarily always have to be removed. In addition, prostate cancers that we want to treat can be treated with things other than surgery. Most commonly would be radiation treatment, which can be radioactive seeds or external beam radiation treatment.
Okay, doctor, her question number 2 was, and I'm sure you get this question all the time. She was wondering if it's possible to have intimacy after prostate surgery. I'm sure all the men and partners and wives ask you that constantly.
Sure. I mean, this is sounds like a day in the life of my clinic, which I usually do on Mondays. So yeah, it's very possible to be intimate after surgery. So the 2 main side effects of surgery, the first is urinary incontinence, meaning that men are unable to hold their urine. And that's something that usually gets better after surgery, but it can take weeks to months and even up to a year to recover. The second is the sexual function can be affected. The nerves that provide the ability for the penis to become erect sit on top of the prostate. And so when we do surgery, sometimes we need to remove the nerves with the prostate, but sometimes we can leave those nerves. So if you can leave both nerves intact and just remove the prostate by itself, then you're more likely to have a good outcome in terms of your sexual function. If unfortunately you've got aggressive prostate cancer and those nerves need to be removed, then that can affect the sexual function down the road.
I'm sure when you explain this to them, they're asking for guarantees here, and there's no guarantees, but it looks hopeful, right?
It does look hopeful, but again, it really depends on what the pathology is. So again, if you say, well, we need to remove both nerves, then you can almost guarantee that that's going to be a bad outcome in terms of sexual function. If, on the other hand, you can say, well, we're going to spare both of those nerves, leave them inside, then patients are much more likely to have good sexual function after surgery. That being said, a lot of our patients actually come in with what most people consider some ED, and therefore we also have to navigate in and around that issue in terms of saying, well, what are your expectations after the surgery? If you come in with some ED, we're certainly not going to make that better at the same time.
Okay, I have a few more questions before I get to Beth's final question. Is this robotic surgery, and how is sexual function then restored after?
So most of the surgery that's done in the United States for prostate cancer is done robotically these days, which is robotic laparoscopic surgery. So anytime you enter into the abdominal cavity and you pump it full of gas in order to create space, we call that laparoscopy, similar to how appendix, gallbladders, colons are removed these days. Then we attach a surgical robot to the ports, and we control the robot from a bedside console in order to do the operation. There are some centers where the operation is still done open, but increasingly surgeons are moving over to the robotic platform to do that operation. In terms of recovery, the recovery from the robotic operation is great. Most patients stay the night in the hospital, go home the next day, usually going home with a catheter in their bladder. That catheter gets removed after about 2 weeks. In terms of sexual function, at that follow-up appointment is typically when we discuss recovery of sexual function, usually starting with some medications, but it can take a little bit of time for that to recover as well.
And doctor, times are different. I mean, I think people are communicating more, which is such a blessing. Do men come in and discuss the issues maybe they're having after the surgery? Is it kind of like a partnership with, the partner coming in or the wife, and the wife speaks for them? In other words, communication better today?
I think it's better today. I mean, everybody's has their own certain set of circumstances that they come in with. I think one of the challenges that we've had during the past 18 months is that there's been certain restrictions on family members coming into visits all across the nation. And so having that discussion with all the family member that's appropriate, or that family unit that's appropriate, has been really, really hard. Setting expectations, going over side effects, risk factors, et cetera, has been exceedingly challenging, particularly around some of these sensitive topics. But I think that the physician's job in this scenario is to make people feel comfortable enough that they can open up and have a free discussion about some of those things.
And speaking of comfort and hope, I want to share with our viewers an inspiring story from a prostate cancer patient. It's a short video. Take a look.
I've always been very healthy. I've always been for me, it's always been about mind, body, and soul, right? It's all combined together. When I first found out that I had prostate cancer, I remember like it was yesterday, the exact thought that I had. And that was, I want to be here for my family, and I am not going to miss my daughter's college graduation. I turned it right around and said, listen, this is going to give me a really good reason to stay positive and fight. And I think that if we're positive, we're going to get more healthy. And if we're fighting something, it's going to help us fight it and win. For me, it's been 2.5+ years, and I've been on this journey from discovery to treatment. I ended treatment at the end of the year 2019, so I'm doing amazingly well. I would say that I'm in remission. My own clinical trial was funded by Prostate Cancer Foundation. Prostate Cancer Foundation probably saved my life.
Oh, Pat, thank you so much for that story. And by the way, the Prostate Cancer Foundation is dedicated to funding life-saving cancer research. So to find out more, we'd like to share with you this website. It's right there, right under me, pcf.org. That's pcf.org. Please check it out. Doctor, we have a viewer question from Michael. Why don't we take that and see what he wants to know, and I'll read it to you. Do certain spices, garlic or cannabis products, help in the fight against prostate cancer? Great question there, Michael. Thank you. Doctor?
Yeah, thanks, Michael. That is also a great question. That also comes up very frequently in the clinic. Patients want to be proactive in their care. They don't want to just step aside and say, okay, you do all the work. And just like our video presenter as well, Pat, they want to take a little bit of initiative in this. Unfortunately, there's not a lot of studies to support some of the naturopathic remedies or naturopathic medicines that people want to try. I know actually, at least for CBD oil, there's been some lab studies to suggest that it does have some anti-cancer effects. And hopefully over the next decade or so, we'll see some studies come out which will hopefully support this, because we'd love to have something to give to our patients to be able to do while we're doing the standard care, so that they can help either decrease their risk or increase their prevention of prostate cancer.
Absolutely. Just a reminder to our viewers, if you want to send in a question to our expert, it's so easy to do. You can email, phone, or just check out the information. Questions@allhealthtv.com. There you can send your question or call us 855-796-4475. Upload a video of yourself with your cell phone right there at our website, allhealthtv.com. Doctor, exercise, diet, we always talk about things. We have a few minutes left in the show. It would be a sin if I did not bring it up. So does that help at all in avoiding things like prostate cancer?
Sure. So the answer is that we know from some studies that if you have a diet that's low in animal fat and high in vegetables, that actually does decrease your risk of prostate cancer. What I usually tell my patients is that the healthier you are, the healthier you be. So if you practice a healthier lifestyle, that you'll be better all around in terms of your physical health, and that'll do better for you. But specifically related to prostate cancer, we know that low animal fat, high vegetable diets are the best.
I have a viewer question from actually a friend of mine who I'm not going to mention her name, but we've only got like 2 minutes, doctor, but I want to get it in. And she says, my husband goes to the bathroom every night 3 to 4 times an evening. Is that a problem?
Well, I would say it's a problem if if the patient or if her husband is annoyed by the fact that he's waking up, typically that frequency of urination at nighttime, we call that in the medical jargon, we call that nocturia. If you're doing it 3 to 4 times a night, typically that's impeding your sleep. And so that's probably something that should be evaluated. And it's hard to know what that is. Typically, or most commonly, what we see as urologists is that benign prostate growth. As men get older, prostate gets bigger, it impedes the urinary flow. So it either decreases your emptying or decreases that ability for that bladder to get a good squeeze to get all the urine out. But there's some other reasons for patients to have nocturia, especially that many times per night. So it certainly needs to be evaluated by a urologist, particularly if it's bothersome to the patient.